Following the outbreak of COVID, it has become apparent to address the need to reduce burden on hospitals to more efficiently reach patients in remote areas and to encourage self-health monitoring. Remote patient monitoring solution therefore integrates medical and ICT solutions to deliver a good quality service for long-term care. Using the cloud to combine patient and hospital data, it aims to achieve the goal to prevent deterioration of chronic diseases through daily health management. Next, we have Johnson, the Managing Director from ADMAS, to share with us about his company and what do they do. Hello, Johnson. Can you tell us a bit more about your company?
Hi, I'm Johnson. I am the Managing Director from ADMAS. ADMAS is a health IT company. We support our partner an efficient way to build up their smart health technology. Myself, I've been working in Africa country for several years, so I exactly know about the problem and challenge what we are facing for in developing country. Most of our solution consider about low power consumption, low cost, flexibility, and cross-platform. For example, the MHIS project is kind of a cloud-based hospital information system. So just in 1 second, subscribe, you can generate your own system real quick. And the MPHR is a personal health record system. So you can support your facility, not just provide a service in the hospital, but also reach to the community and personally. And basically we combine with IoT solution so we can link with more than 100 kinds of wearable devices. So we believe in the near future, the hospital will need ability to take care not just offline but also online. So we are the one to work with you together to the next generation of healthcare.
Thank you. And what solutions do you offer to help with the current issue? Because I'm sure in this COVID-19 situation, your solutions must be really critical.
It has now been a year since the start of COVID-19 pandemic, which has claimed millions of lives and changed the way in which each of us. So if you still remember that at the very beginning, the first question is how we stop spread of the epidemic. And honestly, no one knows about the answer, and all we can do is try to collect the data as much as possible. And also try to reduce the manual work loading, make most of the things could be automatically. So that's why we propose the smart surveillance station. That's something could support for the frontline staff. First of all, we can identify the user based on ID card or national health insurance card, even face recognition, and we can collect the temperature real quick, just in 1 to 2 seconds. So based on this, we will analysis like a gender, age, and based on the AI engine to coming out a flexible questionnaire, just like we will investigate for the travel history, occupational history, contact history, and cluster history. So such kind of thing can really reduce the traditional manual work and speed up the old process. We also provide the platform for the hospital. They can reach to the community, even to the home remote healthcare. For example, they provide online health education, case management, and sort of thing. So based on the web app and IoT, we can use smart way to take care of the COVID-19 patient.
Sounds like your solution really increased a lot of efficiency under the circumstance. Can you tell us more about your major difference or the improvement, like before and after per se, after using your solutions?
Well, I think the most important thing is how we're dealing with these massive data and trying to find out for those abnormal detections. For example, during the period of COVID-19 outbreak, there are 2 things that people have to do while they're getting to the hospital. First is they will need to write down their contact information, and secondly, the hospital frontline staff will need to check their TOCC. That's something I just mentioned about travel history, occupational history, sort of thing. And it usually take about 30 to 50 seconds. I would say it's something terrible once a group of people start in front of the gate in the hospital. And all the people, most of them use the same pen and paper. That will become like a disaster, I would say that. The solution we provide that changed the way all the process is shortened to only in 3 seconds. And if you can imagine all the things, just like a temperature, all the questionnaire could be digitalized, then we can do a lot of data analysis for further early detection. In another case, we also provide online consultation platform, so-called M-Scheduler. Actually, you can find it now in Google. It allows all the clinics and hospitals can have their own online telehealth consult web and app. So once you subscribe, then you can start provide your service. So that's something we empower the health facility with online service possibility.
Okay, and my next question is, does ADMAS have any experiences with working with overseas partners, and can you share with us some examples?
So far, we have different project sites in Southeast Asia country. So just like in Thailand, in Vietnam, in Malaysia, in Cambodia. And the case what we learned in Thailand is they based on the MPHR platform to provide a community healthcare is something like a case management, but they can divide a patient into severe case or minor case. And daily they can collect the vital signs just like SpO2, blood pressure, temperature, and EKG. And also we can, based on the AI engine, depends on different patient group to coming out the different kind of questionnaire. So that's something can reduce their manually work and use the system to use the chatbot to take care of the patient. In another case in Malaysia, we provide a M-Scheduler. That's something online appointment and teleconsult system. And actually, if you go to the Google, you can find an M-Scheduler. You can just search it. And I would say usually if we do the teleconsult, people might think about the line, some communicate tool like a Zoom or Google Meet, but mostly is sometimes coming out a lot of work is still manually. But the M-Scheduler is designed based on the flow of medical care. We can start from online appointment and reminding the message, video consultation, even the online calling, the number broadcasting. So this something can virtualize the offline medical service to become looks like online hospital. And I think it is interesting is because such kind of case is not just using during the period of COVID-19, but also it will grow fast in the near future.
My last question, why should overseas partners work with you? I know you already have some overseas partners, but for those potential partners out there watching this video, can you tell them more about your advantages?
Well, there are something Taiwan good with, which is smart healthcare technology. The reason is since 1995, Taiwan started the National Health Insurance Program. It forced all the healthcare providers must to go through the transition from the paper system to digitalized system. And we are also very good at manufacturing those IT stuff. So that's why most of the time we are glad to learn in each kind of medical care digitalized process, no matter the case is success or failed. And that's something, the experience that we can share with our overseas partner. Just give you an example, the online appointment and the calling system. Such kind of thing, I would not say is a complex system, but it's a quite popular system in Taiwan. No matter it's small system, small hospital or big hospital, all the people, they can convenient to use their smartphone app to make an online appointment, and now getting to the teleconsult. So I would say that's something popular but not much to see in Southeast Asia country, and that's something we would like to copy paste and share such kind of things to you and work with you, and of course learn with you. Then we can grow in together. Thank you.
Thank you, Johnson.